My name is Amanda Dorder. My pronouns are they, them. I'm a white, non binary person with auburn hair and rimless glasses. There's a bit of a reflection in them right now. To the side, there's a curtained window, some paintings of a turtle and a great egret, and behind me, some other office, computers, posters, plants, that sort of thing.
Hi, my name is Noemi Tangelo. I am a Black person. I'm also non-binary. My hair is cut short at the moment. I have glasses that are rimmed gold and black. Behind me is a background of flowers, like purple flowers on a blue kind of background. It's a digital background.
And so we're here today to talk about access healthcare beyond the AODA or beyond AODA, and specifically the video component to this toolkit that we've been creating.
I'm involved in this project as the toolkit and workshop developer and designer. For me, when I saw that this project was being developed, it was very important to me as a project to exist because I have my own experiences with healthcare, and I just felt like there were many moments in my interaction with different points in healthcare where I felt like there was just a lack of understanding, a lack of respect for myself as a disabled, neurodivergent patient. And I just felt like this type of work could move us to in the right direction towards creating healthcare environments that are accessible and based on disability justice principles.
It's interesting when I've been doing research in this project, how many of us have wanted a space to help healthcare providers learn how to be more accessible and inclusive. I think many of us have dreamt of the day that we can actually go to healthcare providers and talk about access and inclusion because of our experiences within healthcare. And I think the degree to which we have to interact with that system. We have a live workshop. We have a tool, sort of a toolkit of complementary resources that are very practical, including checklists and scripts that people can use. And we have this autodidactic section where people can go through a PowerPoint and sort of walk through various steps in a patient journey, considering the videos we've recorded from about 14 or 15 intersectionally diverse cross-disability participants who are invested in helping healthcare providers do better with access and inclusion.
Whether you're able to attend the live workshops or not, we still wanted people that were interested to have an entry point into the material that we designed and that we developed. Um, in particular, the videos I find are very interesting because it spotlights disabled folks in our community um, with with various different stories to tell and perspectives to share. And so for me, I thought that that was really the cornerstone of our of our project, to have these videos, to have these voices that can attest to the challenges that we face as disabled people navigating healthcare. What we find is that certain voices are marginalized from, not just when we think about like societal structures, yes, but also voices are marginalized from conversations, from debates, from public discussion. And so what we find is that there is a lack of understanding that comes from said marginalization. And so when we talk about instructional design and the importance of including these marginalized voices, we're saying that we're really trying to create an environment in which that dynamic is directly challenged and flipped on itself.
Something that I think we both felt was important as well was including intersectional voices. I mean, we all have intersections, but to include a diversity of voices with very different lived experiences, not just around disability, but around race, class, gender, and other identities.
We're trying to push against that idea that there is a singular dominant disabled patient. If you can base your services on this person, on this kind of this archetype of a disabled person, you have all disabled people accounted for example. And we're trying to use intersectionality to really force ourselves to think more critically about who it is that is seen, who it is that is accounted for, who it is whose needs are are taken into account, and to make sure that we don't have these power dynamics that are affecting how we provide care. So there are a lot of things that are similar across these various narratives, but at the same time, there is that diversity of experience that you will see as you're listening to these narratives. So it's important to hold both of these things to be true at the same time, and really try to consider how factors that other social factors might be affecting that those differences that you see in the narratives themselves.
So I think a lot of this is really about how can you bring, as a medical professional in whatever area that you work in, how can you bring your experience to our experience to create stronger healthcare outcomes for us. And I think more broadly for the community, because I hope that this will help folks. I hope that as people listen to the uniqueness and the commonality of our stories, it will really open you up to a broader thinking and a broader approach. So it isn't how do I work with person A or B, but what is the skill set that I need to develop to better be able to serve disabled folks in a, anti-oppressive, intersectional, culturally competent, supportive, and productive way.
My name is Patrick Brandt. I am Ganagahaka, otherwise known as Mohawk. I'm a two-spirit male from Kingston, Ontario. I have black hair, rectangular rounded glasses, and am sporting a mustache and goatee. In regards to inequity in healthcare specifically, I am an Indigenous man who's on the spectrum with ADHD, family trauma, like, two-spirit. There's a lot of intersectionality. I'm a queer person also. So sometimes it's hard to determine where certain attitudes come from. While we can see systemically where some trends towards, it's always hard to place it. So often people with many intersectionalities like myself are left guessing about why something's happening, which is a really big thing. Dealing with renal failure, specifically regarding mismanaged medications with a misdiagnosis of it being an autoimmune condition, despite not having found the actual evidence. It was assumed. So that's a big place where the inequity starts. It's where the information's held. We're told in absolutes, these kind of diagnoses without knowing ourselves, with it coming into this situation for the first time ourselves, we don't have a frame of reference. We don't have the schooling. So that is a big thing that I find lacking in the medical profession, that the sense that it's an opinion of the doctors, as best evidenced with what information they have. But as the person going through it, you also have access to your own information. You have you're the person going through those feelings, those drawbacks, those hardships. So you know your body best. As a neurodivergent person, I am a big researcher. But I often have it dismissed because of that same neurodivergence. Uh, because often medical professionals, I find, do not take somebody who hasn't received classical training and doesn't value lived experience as much. I've had several research positions spanning probably about 15 years at this point. Um, and so I do know the basics. So it's comprehending how to find information and supporting evidence. So it's that invalidation that just because we're different, that we might not know. Another big issue that I've run into is as an Indigenous person who has had an addiction problem in my past. It was noted on my medical record as active status, but never taken off, which I have found has led to everything from being denied pain meds while having a tube ripped from my chest, being in like 10 out of 10, the worst pain I've ever had, and being denied these meds, to going to emergency room where I was on my way to needing a hip replacement. They thought I was just med seeking. They didn't even send me to imaging or anything. And just because I'm an Indigenous person, it was brought up instead of my joint pain. The reason I went through addiction was because I was untreated for my ADHD and autism. And so I sought out something that would help me, which ended up being stimulants, because I was failed. I was failed right up until I hit my limit. That's another thing folks don't see. They see these black and white statements, but they don't see the human factor behind it often. So you have to keep explaining yourself. You have to keep pointing your position and hope that this time somebody's going to listen to you. I think they see somebody being involved and they think it's being combative. But often it's just the person wanting to work with them, wanting to receive the best healthcare and path they can, because they're not getting that individualization. And so that's where we see the pushback. Thing that I experienced, specifically regarding Indigenous care in the hospital system, is that I went in and I was on dialysis, and the hospital has an Indigenous patient navigator, and the cancer center has an Indigenous patient navigator. The renal unit didn't when I started out, at least. So I had to advocate for that too, just because those cultural ideas were being dismissed and I wasn't being heard.
Obviously, Gabby, she, they pronouns. I am a co-founder of A4A, which is Autistics for Autistics. We're actually a partner with SILT in the Disability Coalition, so that's how I've heard of this opportunity. We basically, yeah, like do a lot of workshops when possible, like educating, like spreading awareness about autistic issues, because the major gap is there's a major difference between parents of autistic kids and people on the spectrum who are over 18, for many years it's been the parents doing more or less speaking up for us, even though a lot of autistic people have made it very clear that they want to speak for themselves and not continue to be treated as kids or helpless in general after coming of age. In addition to being autistic, I also have ADHD, anxiety, and dysthymia. Being neurodivergent and dealing with the healthcare system to be like stepping on the landmine, because I'm like, it's really like like on the one hand, like I'm pretty good at advocating for myself. Either I don't get believed very much when I have, come in with an issue or concern, or when yeah, but basically in general, I am just seen as, well, you speak too articulate to be autistic or just neurodivergent in general. And it sucks because it feels like, yeah, like it feels like I have to either play myself up to look really helpless. And yes, you have to ramp up symptoms, or you have to like try not to divulge too much that people would think you're would assume you're thinking suicide and call, well, let's check on you or something. You know what I mean? Like it's very hard, like balancing this. And the biggest barrier for me right now is, so I'm non-binary. I don't fully fall into binary trans mode of, and unfortunately, that's also the second biggest area I'm struggling in right now. And that, like I know myself best. Like I know I don't fully fit in with this. Like, yeah, I'm a person of color. Which makes me feel like, again, I don't know if it's, even if it's not on purpose, but I always get a sense of the other person probably thinking that I'm looking for drugs. The other thing I definitely struggle with a lot is, how weight is treated towards racialized people. Because like for me, in terms genetically and culturally, I'm Latino, and more specifically, like I am mixed in that I don't know my full family tree, but like the majority of people the majority of people in my region, Central America, like we're a mix of European and indigenous. And for me, like I ended up more with the indigenous genes, like basically shortness and chubbiness. And it's like I'm fully aware of how like those ancestors used to live, like a lot of a lot of maize, like corn. So genetically, I'm never going to be like supermodel thin. But yet, every single time I see stuff about the BMI, like I'm probably considered more morbidly obese.
I'm Matt. I'm interested in idea and healthcare because of my lived experience as a mad person, mad and racialized. I've been involved intensely with the healthcare system since the age of 14. I was first hospitalized at the age of 14. I've spent most of my life in and out of hospitals, also seeing like allied health professionals in the community, and more recently engaging in peer support. Some barriers I faced are like the reticence of the system to look at dual diagnoses. So a while ago, I had like an eating disorder that manifested on top of my mood disorder. They were closely related. Like the eating disorder emerged out of like a lack of control in my life, the mood disorder as well. But the systems that I was receiving care from insisted that I treat one before the other, not knowing that in only treating one and not the other, it was exacerbating both of them. And it was just really frustrating to try to get care. Or the eating disorder as well, trying to get care around like a certain BMI, like the very limited pseudoscientific criteria for receiving care, meant that I was really leaping through hoops.
Hi, my name is Jet. My pronouns are they, them. I'm wearing headphones. I have long bleached hair, dark eyebrows, and facial piercings. My eyes are brown. I have tattoos in my hands, and I am Latino, a queer Latino, mad, invisibly disabled, and autistic. And the reason why this project is important for me, it's because as a person who lives with, mental health issues and disabilities, navigating the healthcare system is like part of my life. I have to do it all the time. And I really want to see positive change in my lifetime. And I think that projects like this can really inform how to approach healthcare with more compassion, with more patience, and and in a way that is not traumatizing. It took 4 years to convince my gynecologist to give me a laparoscopy, which is a small incision, very non-invasive procedure to remove the 5 tumors. It took years of a lot of pain, of rehearsing my appointments, because every single time I went to the doctor, I will leave upset because I couldn't defend my point. So I literally had to write scripts and rehearse with friends, because at some point I was like, I'm not leaving this office until I actually get what I need, because there's no possible way I can continue to live with this pain anymore. And one of the reasons why they didn't want to do the surgery is because they perceive me as a female, and they said that I was too young, and they were waiting for me until I had children. But that's not something that I planning to do. I remember when I brought to my psychiatrist that I think I was autistic, and he just said I was idiosyncratic. And I remember having a horrible panic attack in his clinic office, and he coached me to pace around and do box breathing. I felt so invalidated, and I already have complex PTSD around invalidation.
My name is Leanne Charette. I use she, her pronouns. I have cerebral palsy, and I'm predominantly a wheelchair user. Right now, I'm sitting in my purple wheelchair with rainbow spokes. I am a visibly white woman with light brown hair, brown eyes, and sort of bluish purple rimmed glasses. I'm wearing a pink floral dress, and my background is blurred. And a little bit about what drew me to come and speak today. I have experienced a lot of treatment with the medical system, some of which has been very positive, and some of which has really taken me off guard despite my experience dealing with ableism from birth. Sometimes I find myself just very caught off guard in moments where I suddenly realize that my disability is drastically altering either the way I'm perceived by medical staff or the quality of care I'm receiving. And particularly for me, that relates to access to like reproductive care. I'm a mom of twins, so I had a high-risk birth as well, and a lot of struggles leading up to becoming pregnant, as well as accessing care while pregnant and in the postpartum stage. And just in terms of accessing just general women's healthcare, reproductive care, and the barriers physically and attitudinally to those as well. So I'm passionate about hopefully making that experience easier for any others that might follow in my wheelchair tire tracks after me, so they don't need to go through the same experiences I did. It's made very clear to me that I'm supposed to have, with my general care practitioner, 1 appointment per issue. And the tricky thing is, I think anyone who's disabled and chronically ill will relate to the fact that we often have a lot going on and they all intersect. And so it's very difficult when you're trying to deal with one issue when you know there's a good chance that you have other health issues that are all affecting each other in this intertangled web. So you're going back multiple times, using up a lot of spoons and often funds to try to transport yourself there. And then you don't get the issue addressed. Or you can try to make a more complex appointment and still somehow find yourself villainized for that. So there are moments that maybe a lot of other folks in this community will relate to, where we try to be proactive, we try to plan for the complexity of our needs, and somehow still find ourselves feeling not heard. There's a sense of defeat that can come into play when you know you have ongoing issues, but you also are painfully, sometimes literally painfully aware that it's very difficult to have them addressed. So there's this sense of sometimes on my part, like a sense of apathy of even to work up the emotional or physical energy to schedule the appointment, to make the call. I don't live in a city that's tremendously easy to access public transportation, or where it's particularly accessible for my needs. And so I'm reliant on people to drive me as well. So there becomes further need for me to make my appointments count. There's tremendous amount of pressure to make sure that appointment meets my needs and counts. And I think even before I get to the appointment, the mental pressure that I feel to make sure that I don't miss a point, that I don't get overlooked, that I don't forget to say something important, is daunting. It causes me a lot of anxiety and uses a lot of emotional energy, as well as the physical energy that I'll then need to manage the appointments. I would mention to my doctor, that I would look at my charts, and it was very clear that I was not going to be able to become pregnant without some assistance. And my doctor would he said to me, lots of people don't have children. I don't really see the problem. And it was very clear to me that he just did not think that I particularly should have children. So that was really distressing. At the time, I was a lot younger, and I certainly lacked the confidence. I did not report him. I do wish that I would have, but I know that there's a fear too that perhaps it will impact your future care. I do think that impacted me to some degree. But when I did finally push hard enough to see a specialist, I really did have to push for that. I would come in every month, which took me a lot of effort, and continue to show him the reasons why I was sure that I needed to see someone, until he was just worn down, and he referred me to a specialist who immediately diagnosed me with exactly what I thought I would have, which was polycystic ovarian syndrome. And in my case, I was really fortunate. And with one single round of meds, it worked. And I was pregnant, which was a joy to me after many, many months of spending a lot of time and energy really having to fight to get to that point. And when I found out I was pregnant, my old doctor, the one who I mentioned before, who had been quite resistant to referring me on for care, had retired. So when I came into the appointment to confirm my pregnancy with my doctor, that was the first time I met my new doctor. And when I went into the appointment, I was excited. I was buzzing with joy. I mean, you could see it on my face. He came into the appointment, and he said, "What brings you in today?" I was like, "Oh, I just found out I'm pregnant." And he paused, and he looked at me, and he looked at my mobility aids. He didn't look at my chart, which I want to note, because it would have noted how many months that I had worked hard to get to this point and how wanted this pregnancy was. He just looked at me and said, "I don't understand. Do you want me to terminate it?" And I wish I would have said something, but I was just gobsmacked. While I was made to feel like I was very rare for being a disabled pregnant person. 1 in 8 pregnant people are disabled in some way in Canada, whether that's visibly or otherwise. And it was not something I was aware of actually until years later. It's strange to be treated as this rarity when, in fact, we are very common. And yet the spaces designed for care, particularly for reproductive purposes, are really not designed with us in mind. And you're aware as soon as you come through the door that even though your name may be on the schedule for the day, you as a disabled person are not expected in that space. And that was difficult to navigate, especially with a high-risk pregnancy with twins, which I ended up finding out that I was having. But the start of the pregnancy, just so blatantly being told to me, more or less, like, you shouldn't be pregnant, was quite shocking. And I would hope that no one after me would have to experience the same thing.
I am a white woman with long, wavy to straight, red-brown hair, wearing a purplish pink t-shirt.
It's like the bias towards weight in healthcare was the barrier to like getting proper healthcare. Because like, beforehand, like when I was having a lot of muscle symptoms, like it was mostly like attributed to like my own like faults or bad, quote unquote, bad lifestyle behaviors. And I didn't like get the right referrals. I was just told to keep like I was basically the control for my healthcare. My health was like put on me, like a very individualistic, medical model of like, you need to do these things to get better, but like there's nothing else causing these symptoms. So I would say another barrier that I face in healthcare is getting the wrong diagnosis too quickly, and then doctors having that diagnosis like cemented in their heads, and therefore not wanting to look outside of it and just accepting it as the status quo, and also getting a diagnosis that I feel is very highly stigmatized in healthcare, which is fibromyalgia. And because technically supposed to be a diagnosis of exclusion, I was given this diagnosis even though I did not get tested for everything possible. But because I had the diagnosis, other doctors would say, well, they must have tested you if they gave you this diagnosis. And then it just became such a barrier where like people like refuse to do any tests on anything because, fibromyalgia, it's supposed to be like an illness that causes like, different types of symptoms like pain, brain fog, things like that, but it's not like measurable necessarily. So anytime I had an injury or pain somewhere, like they would say, oh, you're just overly sensitive to pain, just your fibromyalgia, like just go walk more, eat better. And like there was so much that was missed because of that. Like, for example, like maybe you could tell my voice is a little hoarse. Like I lose my voice really easily. And it's because I have swallowing issues, because I have muscle disease. But that muscle disease took me until 2023 to get diagnosed, even though I started looking for the cause in 2017 because of the fibromyalgia misdiagnosis.
My name is Rebecca Wood. I use she, her pronouns. I am a white cis woman with a round face, dark curly hair with some gray in it, thick eyebrows, brown eyes, sparkly nose ring. And I am recording from my office with colorful books behind me, some plants behind me, and some framed degrees on the wall. I am a multiply chronically ill fat queer woman with episodic disability and invisible disability. I am a writer. I work in the disability sector doing peer support, and I am very happy to be sharing my healthcare experiences as someone who's been navigating chronic illness, mental illness, physical illness, disability for over 20 years. I do a lot of navigating my care team. It is often hard as a patient to keep track of everything and feel like I'm the only one seeing the whole picture. When I go see my rheumatologist, she's looking at one system. When I go see my gastroenterologist, he's looking at another system. When I see my neurologist, she's looking at a third system. I'm the only person who is holding all of my systems in one place. And I do a lot of figuring out, what symptoms are connected to which diagnoses, what symptoms should be brought to which specialist. And I also do a lot of worrying about whether I've communicated my body and experience effectively to the doctors working on my care, because if I don't communicate the full picture or I don't communicate the right pieces, then it feels like I don't get the proper or I might not get the care that I need.
I go by the pronouns she, her. I'm a white appearing woman. I'm wearing some dark framed glasses. I have shoulder length brown hair with bangs. I'm wearing a red sweater, but it's like I forget the name, that open in the front with a red beaded necklace. And I'm sitting in my home, which you can see behind me. It's not blurred, so my whole home's on display. But yeah, couch, bed, everything. I'm ambulatory, but I need a wheelchair for distances. So yeah, I showed up there. The lady came down, and as soon as she saw me, she started doing this thing that a lot of people do when they're uncomfortable around people in wheelchairs. She started cooing at me and saying, "Oh, aren't you a cute girl? Oh, look at your cute little dimples." And this woman had obviously seen my file. She knows that I'm middle-aged. And I was kind of shocked. I hate that cooing behavior. I've seen it before. And like at one point I was like, maybe I should just get like a buzz cut and look super edgy and people won't coo at me anymore. But I've done like various things over the years to try to make myself look less cooable. And like they don't work. They just don't work. It's like I'd have to literally put on like a monster mask or something or like do something completely, I don't know. I'm not saying that I'm cute. I'm just saying they misinterpret who I am as a person, and maybe I'm to blame for that in part because I wear cute things sometimes, and I wonder if I play into it a little bit. Like that's possible too, right? But not on purpose, just out of again survival. It does make me feel now kind of anxious about any further sleep studies I might have to have, any further communications with this clinic, because like I said, I have that follow-up, and then at least I do now have an opportunity to maybe rise above the like ha 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 wasn't that funny kind of defense mechanism and say this was wrong. So I didn't actually think it was funny. I just behave like it is because it's what I know how to do. I was trying to find an accessible bathroom, and this is before they did their whole renovation. Now it's a little bit better. And they didn't have one in the area that I was in, and I couldn't go too far. So I asked the receptionist in this clinic, and I said, "Look, I need to use the bathroom." Um, and at this, I wasn't feeling well enough to get up out of my chair and just walk in there. So I was like, "Okay, I need to deal with this, right? I need to take my chair into the bathroom." And it was big enough for the chair, but it didn't have an automatic door, and it was a little bit hard to turn around in. So I said, "Do you mind just opening, holding the door for me and I'll go to the bathroom?" And um I thought because I thought she was smart enough to realize that if she had to help me get in, she had to also help me get out. So I get in, and then she goes back to her desk and working away, and I'm realizing, okay, she's not there to open the door for me. And I tried calling, and of course, it's one of those clinics where they don't pick up. It goes to voicemail, and you might get a call back in like 6 months or something. So I just had to knock on the door and be like, "Hey, let me out." And she came back and was looking so confused as if she kind of forgot that she had helped me, that I was in there. And I said, "Look, this is not cool." I said, "I was waiting on you to help me get back out. What the heck?" And I yelled at her and I said, this is not great. Like, it was already a difficult day.
I am also medium skin tone, a bit more light, but a bit of a tan right now. I have in the front short hair with blue in it, shaved sides, gold glasses. I have a round face with cheekbones with a very Inuit nose. I have hand tattoos and tattoos on my shoulders of flowers and a pronoun tattoo with a flower and a knife. I'm wearing a blue top and a Playboy necklace and with a white background. And then my name is Hope or Hopadina. My spirit name is Standing Otter. And that's Nawabenagig and Chippewa. I don't know the exact dialect from mine, but I am half Inuit, half Métis from Yellowknife originally, but my family settled just south of it in a place called Fort Resolution. I am a reconnecting native. My mom is 60 Scoop. I am disabled since I was about 8 years old, and so been disabled most of my life. I feel it's a very different experience from people who are recently disabled and versus being disabled from childhood. It's a very different experiences I've found, and it's like very different ways we view it. And I am an activist in the local community. I do protests, events, land acknowledgements, workshops to teach land acknowledgements or about Native culture or disabled stuff. One of the biggest ones is like just being perceived as Native. It feels like I have to go to specific hospitals to not be racially profiled. So it feels like that's one of the main ones that as an adult. When I was a kid, it was more like having to advocate for yourself, but your parents being in charge is a huge barrier, in my opinion. If you're like over 13 and disabled, you should be entitled to bodily autonomy. So I think as an adult, a lot of it is race, a lot of it is that I'm very young and I don't quote unquote look disabled, even though it's like lift up my shirt and I have a 12 centimeter long incision that you can see in my ostomy. I use a mobility aid, but somehow people still think it's somebody else's mobility aid. I'm scared to go to the ER because I'm in pain, and I'm scared to ask for pain meds because I somehow managed to not have that problem. My mom was an addict, so I'm very on it with my medication and everything. So it's like going to the ER. I dread if I'm not going to the right ones that I'm going to be racially profiled and withheld medication because of the stereotypes that people hear. One of the biggest ones is I think because I was Native and like at Mount Sinai, I had my fourth surgery there. I've had six. When I went in for surgery, one of the things they do is like they get your race and your religious background in case something goes wrong and you want specific care, right? So I wrote down that I'm Native, that I have one kid, that et cetera, et cetera. They opened me up and it turns out I had what looked like a tumor on my uterus. And legally, they were supposed to wake me up and ask consent to remove my ovary and tube. They did not wake me up and instead elected to do it without my consent or knowledge. They just did it and woke me up from surgery and were like, oh, by the way, that happened. And I wanted more children. And so when I woke up from that, like woke up from surgery, I was in recovery for like 20 hours because every time I would wake up again, they would tell me this again, and then I would freak out again, and then my heart would freak out again, and then I'd pass out again. And that was probably the biggest one that I would want to lodge a complaint about, but I don't even know how. Like, that would be a very complicated case to prove that the random OBGYN racially profiled me. But I think it was a factor into her logic and thinking to remove my ovary without my consent. That they looked at all these things and were like, they don't need that. And then I had my fertility specialist and my gynecologist. They went through the OR recording. So like, you know how they record while you have surgery, like the audio. They went through that. They went through the reports and everything, and all of them said I could have waited another month and had that surgery done. They could have harvested my eggs and then went back in and took out the ovary. There was time. It was not like urgent. It was just unexpected.
My name is Karen. My pronouns are she, her. I'm a cis woman of color with background with a disability. So my interest in this participating in this healthcare project comes from my own lived experience of navigating the healthcare system with physical disability, mental health challenges, and just being able to share my experiences in the hopes that other people who have various intersectionalities can also have their needs met. The barriers that I have faced in my healthcare are physical barriers, so inaccessible offices, but because of the nature of my using up until a few years ago, a manual chair, I could somehow access certain offices, but it was the physical challenges of exiting spaces to get actual tests or to be examined. That's been a barrier in the past, and then there's systemic barriers lack of funding for physical therapy when helpful. You have to have a family plan, so I can get four sessions as part of my healthcare now because my needs have changed. But I found that generally you have to have a private plan to have ongoing therapy. I couldn't afford it, so I have experience also have received cleanings in the past. There were times when I would have procedures done and they would tell me about the procedure, but because I wasn't aware of how I experienced my physical disability, the way that I would react to coming out of surgery or experiencing having a tooth pulled is a very frightening experience for me because my body responds with spasticity to certain things. And so as a kid, I remember having a surgery and then waking up and my legs were spasming, and nobody told me that that was an outcome to having surgery. So it's very frightening. And I remember I was very upset, and I was so upset and angry that they had to call my mom into the recovery room because they couldn't understand what I was saying. So my mom came and she calmed me down and she told them, oh, she's saying it hurts. And finally they realized that my legs were pressing me and they kind of put a warm blanket on me and then it stopped. But it's those kinds of things that not giving a full picture can cause unnecessary stress and trauma to some people because of their conditions.
So my name is Gift Chuma, and I use he, her pronouns. I am an accessibility consultant. I work within the nonprofit sector around advocacy-related initiatives. I'm a Black non-wheelchair user, have dreadlocks, short dreadlocks, wear black glasses, and have a little goatee on my chin. And today I'm wearing a somewhat grayish shirt. And yeah, the biggest barrier is finding first a family doctor. That's usually one of the biggest. And number two is finding specialists. So as a person with a physical disability, I do have quite a bit of specialists that I follow. I guess knowing where to look and who to talk to. I had to lean in mostly within my leaning on my disability community colleagues to get assistance with that, as they already had their own personal experiences and they were able to point me towards the right direction. I'd say like, yeah, that is one of the things that I did come up against. And also like figuring out other components of care, right, that are not necessarily related to health, but also related to access needs, like figuring out like when do I get an OT for my wheelchair repairs or for my house adaptations and all of that. So it's basically that's been kind of like a bit of a struggle, like in the beginner phase. And I would say like what lacks is like basically having a main hub where people can get information and they kind of they get to redirected to the appropriate places, kind of like a functional service point. Being taken seriously by healthcare providers is another huge barrier that I've witnessed or that my peers have witnessed. And yeah, often when you're dealing with healthcare providers, they think they know what's best for how you need to be helped. And that's usually something that we kind of need to come up against time and time again. It's demeaning, like you're not taken seriously as a human first, you're not also taken seriously as a full-on independent adult.
Right.
Whereas in other scenarios, that wouldn't even be a question. So I'd say like that's like one of the struggles. And if you do have someone within your family circle, whether it's a friend or a family member, healthcare providers tend to address that person instead of addressing you, or they make assumptions about your health, right? So, for example, I was meeting with a healthcare provider about my care services at home. Um, and the care provider assumed that my barriers are a certain way before even asking me what assistance do I need help with. Assumed that I need X and Y assistance or that I experience X and Y barriers when that's not actually the case. And this was like an act of it was an act of like ignorance and prejudice because it was based on how I looked and assuming that how I look equates to specific barriers and it equates to specific needs. For people with physical disabilities, there's a lot of vulnerability attached to having a physical disability when you're having someone like PSW help you. And that requires a lot of safety. So when that safety is violated, it's hard to let someone into that space again because we are expected to be vulnerable with our bodies. We're expected to be vulnerable in every facet of our life. Also, another thing that needs to be accounted for is the intersecting identities that come with someone with a disability, right? So, all of this is impacted by, their disability and their gender, their disability and their gender and race, right? Their disability, and their gender, race, and sexual orientation, right? So all of those things are at times not taken into account when looking at the barriers that people with disabilities experience. Fighting the same system, but from two different angles, from my disability perspective and from my racial perspective. And I'm having to kind of like navigate that tension, that conflict. And I think if it wasn't for my racial identity, I feel like the way I fight for my disability rights would be very different if I was from, a majority ethnic group.
Kurt speaking. And that's my sign name. I am a dark skin. I have a shaped head. I'm wearing a gray sweater. I have a green background. I have the word Guyanese is across my sweater. I am sitting in front of my laptop. I'm using Access in the form of a sign language interpreter. I've been an advocate for several years and a facilitator for workshops. Just for the betterment of my community and to advocate for myself and for them as a Black person of color. I'm always, taking care of myself, my mental health, my physical health. I go for regular checkups with my doctor. And I guess the most prominent barrier is just finding medical professionals who are BIPOC and understand me as a deaf person, as a deaf client. There's always trepidation and hesitation when I walk into the room. And most practitioners don't understand deaf patients and how to receive them, how to communicate with them. So every time is the first time, essentially. I know that hearing clients, I understand that hearing clients might have a lot more accessibility, and I just don't know why that's not the same for the deaf community, just to access an environment, a healthcare environment. I mean, in 2025, in Canada, I think that we should be better than what we are when it comes to surgeons, doctors, pharmacists, just healthcare across the board. That's just my opinion. It's a very weak system in regards to access. Accessing sign language interpreters as well is always a challenge. If I have an interpreter, obviously things go a little bit more smoothly, but in the absence of that communication, I mean, any host of things can go wrong, and it's always a negative experience for me without an interpreter, without being able to voice my concerns in my first language. My name is Gaytrey. I have several tattoos on my arms. I'm wearing a tank top, that's tie-dyed with black. I have gold earrings, which is representative of my home country, Guyana. I have red dyed hair. It's up in a top knot right now. I'm wearing a necklace. I've got some bangles. And I've got some serious red vampire nails.
And when the kids are sick and I have to go to a doctor's appointment or the emergency room, my kids have to do all the talking and I feel bad for them. There's no interpreter. So I could say as a mother, hey, I'm bringing my kid in because of whatnot. I have to ask what was being said and use the kids as some kind of interpreter because one is not provided. People don't look directly at me. They deal with the child directly, which is inappropriate. And, I just feel like it's not appropriate to put my kids on the spot like that. And they're overburdened with interpretation on top of them being sick and me being the mother, the caregiver who needs to come in. It's also undermining of me as a mother. I feel awful that this is the situation. If you had an ASL interpreter there, available in person, we could function as everybody else does in the emergency room, like other parents. It's a high risk for us and it's an emergency situation. It puts us at further risk. Our healthcare is at further risk when interpreters are not provided. after surgery, I remember waking up feeling really groggy and dizzy. And I'm like, ooh, how am I going to communicate? How am I supposed to communicate with groggy with a doctor and nurse if I can't use my first language? And they don't understand sign language. So I can be somewhat articulate, but I'm groggy. So I need someone there, a professional, to help mediate that communication. This should be available to all of us. Not only deaf folks, but deaf blind people too. I bet you they don't even know about that. People who use hand over hand, have interveners, or what's it called? Protactile. There's lots of ways to communicate with deaf and deaf blind folks, hard of hearing folks. And it just breaks my heart to see people in worse situations than me who suffer more than me. And there's a lot of suffering. It's heartbreaking when accommodations aren't met, and the system must improve. It needs to improve. I did make suggestions to one doctor. I wrote a whole new, like when I first met my doctor, my family doctor, I had to write down what my accessibility needs were. And it was, I wrote down a lot of things, but they didn't ask. I had to tell them, these are my needs. Nobody asked me what my needs were.
Anytime we have to get results of any sort, or making a new appointment.
Oh, yes, from Courage.
They call my phone and it's a voice call.
Exactly, from Andrea. What?
Numerous notifications to text me or call through the video relay service.
Oh, you said it. Correct.
And then they claim to charge me for a missed call or a missed appointment when they did a voice call that I never received because I never heard the phone ringing. When I go for an MRI, I was supposed to go for an MRI, and I said, please send me an email or text me with the details. Maybe if the time has changed. And I heard nothing, saw nothing. And so this week I have to call again, like, hey, by the way, I'm still waiting for this confirmation. So it's just an extra layer that I'm doing somebody else's job just to get the access that I need for my own tests. My name is Andrea Zachary, and my sign name is here. I am a Black woman. I have glasses. A blue striped shirt. I've got a brownish gray background. I've got gold hoop earrings. My frames on my glasses are dark brown. My gosh, I could speak for years about this topic. I wear many hats. I am a mother of 6. I am a very active member of the deaf community. That is my heart, my passion. Currently, first of all, thank you so much for this invite, because it is so important, such a hot topic with regards to barriers for our community. I'm on the board of Black Deaf Canada. I'm on the board of Ontario
Business Advocacy, I believe. Cultural Society of the Deaf.
Ontario Cultural Society of the Deaf. I've been on that board for probably since 2021. It's gone through a lot of changes. I'm also a sign language instructor, an advocate. And I mean, on the political side, not in depth, but more just on the accessibility side, and hoping that gets better. I'm a business owner, Deaf Events and Beyond, trying to bridge the gap between the deaf world and the hearing world.
It's always our burden to make sure that they understand us. And so learning ASL would be something that should be taught in society in general, but in medical school especially. I mean, I think there's a lot of assumptions being made that we need more time. And then also, because the grammatical system of American Sign Language is on the face, they think we're being rude, but we're just expressing language. And some of those expressions look odd to hearing people, and they make assumptions. Oh, they're being rude. They're expressing in a certain way, but we're not. And when it's not interpreted, you can't tell what we're saying. So we're not angry, but a lot of people think we are angry and that we're signing furiously and we're making a scene, but we're not. It would be really nice if everyone had similar training, including ASL. I mean,
it just ongoing education about the deaf community, a bit of sign language, so that, basic appointments can be accommodated without having to rely on an interpreter. We have such a range of people with disabilities and how they show up. It looks different in everybody. It's not, one size does not fit all. Like I was trying to get a diagnosis for the pain I was having, and it was hard to find one. And then it was too late because we couldn't get an interpreter and time was running out and my pain was increasing. And so they what?
I had gallstones.
It turns out I had gallstones, and it just didn't have, when I was alone, I didn't have the empowerment because I had no communication to explain my symptoms and get an interpreter. And, I had to suffer while we waited for my family to come. It's a huge challenge. It's a problem with the system. It adds layers and layers to deaf people's suffering, and it's a huge issue. And so now we have to figure out accommodation backups for ourselves. And often it's not what we want. And, I had to go a million.
I had 8 months of pain. I had to go to the doctor several times. I wasn't informed of the side effects that this surgery would have, having my gallbladder removed. I wasn't told about my diet being changed. I gained weight out of nowhere. And it's just everything. I was left in the dark about all of this stuff.
I'm Minette, and I'm visually impaired. I think this project is interesting to me because there's a lack of understanding with healthcare professionals how to accommodate people with visual impairment. They don't always know, and sometimes it's not easy communicating one's needs. The doctors, they overbook. They don't take into consideration someone like me who uses Wheeltrans and has to stay on schedule. And when that happens, I find that I'm panicked. When I go in to test my blood pressure, it's always high because I have to keep sending my mom to go, let them know I have to leave X amount of time. And that has happened a number of times. So stressed out, you forget half of what you have to ask them. The other thing is that they don't even have the time to listen either. Right, regardless, as soon as you start talking, they start writing. And when that kind of makes me feel they're not listening. With these barriers, it's hard to kind of want to go access healthcare because they're sometimes attitudes as well, unconscious bias attitudes as well can be stigmatizing, how they kind of respond or how they, I can tell from their body language and the way they speak, they have some sort of bias towards people with disability.